happiness begins. I believe we have a moral responsibility to call for change, and it is also our goal, while highlighting it as a public health issue, to call for change today. And without further ado, and to continue to elaborate further, I would like to introduce an amazing pediatric intensivist in this community who cares deeply about the public health related to children and their families, Dr. Bob Beck.
Thank you, Chaplain Heather. It is a pleasure to be here, and it invokes emotion as next speaker, my colleague Oreste, and I care for these children together. So research shows that children die, young adults die from guns, as Chaplain Heather said. And in the United States, 58% of all gun deaths are homicides, and the rest are accidental and suicide. And when you deal with an 8-year-old who kills himself by suicide, it is difficult. The statistics have increased markedly by 29% since 2010 on these numbers. The American Academy of Pediatrics has long supported research in preventing gun violence and also with behavioral and other changes to limit this. In the end, the American Academy of Pediatrics and all the pediatricians in this community are trying to lessen the psychosocial environment of damage. We look at the data in West Michigan and in Michigan as a state, and we saw, as Chaplain Heather said, the number of kids dying from gunshot wounds is higher than the number of adolescents and young adults dying from car accidents. We need to create a safer environment. Injury prevention science is there, and we ask the legislation to play a crucial role in this, as they have in reducing incidents of injury and death in automobile crashes. There's data from the National Library of Medicine that show that pediatric focus on gun violence is needed. We need to make changes. Another article noticed that children exposed to gun violence have a higher propensity to propagating this in their own lives because of psychosocial anger, withdrawal, post-traumatic stress, and those other things that go along with witnessing death of family members and friends. The data shows that children 1 to 19 years of age are at higher risk of death from gun violence than anything else. And those who are in close proximity to guns are at even higher risk. We as a society need to target youth violence and try to intervene before it reaches the level of gun violence. We don't need to minimize the impact of what gun violence does to our community and what it does to our healthcare teams. Every one of our healthcare team, whether it be a respiratory therapist, nurse, or physician, are impacted many times detrimentally with each of these cases. In these last 3 years during the COVID epidemic, the amount of gun violence has risen. And when you see the number of healthcare team members who have left the bedside because of that for their own mental health, which only then impacts and puts more stress on the teams at the bedside currently, it's amazing. So with that, I'd like to pass this off to my friend and my colleague, Dr. Oreste Romeo.
Thank you, Bob. Thank you, everybody, and thanks for the opportunity to speak. This is a very, very important cause. We have seen changes that are steadily maintaining the same pace. We've seen changes continuing to occur in our communities, and I will kind of draw attention to the fact that while mass shootings really command the most attention nationwide, we're still seeing time and time again multiple casualties coming at once. The strain Dr. Beck was actually alluding to is being felt by teams, has put the hospitals on high alert, has created disruption in the care all across, and for many of the cases that have even occurred in Michigan, we have to just look at much more than statistics. One patient injured by a gun is one too many. 2017 to now, if you look at the statistics drawn from the if you will, the numbers, so to speak, occurring across from 2017 to now, at least 200 patients have suffered gun violence, notwithstanding other forms of violence. 62 people were killed, 193 injured. When you think of a gun type violence, when you think of any penetrating violence, you have to keep in mind that there is a long-drawn process of recovery, a long-drawn process of recovery in the hospital, and then a very impactful change in the life of anyone that has been suffering, any victim that has been suffering these horrible injuries. That draws into the resources that healthcare is to provide, that impacts the psyche of communities in many ways. That makes us feel less secure, more vulnerable in general. COVID-19 was a lesson in many ways. It was a pandemic that has started with some degree of complacency to the fact that it was not reaching us, and then it did. An epidemic such as the gun violence is very much in our lives. I'm the father of a 13 and a 15-year-old. And the idea that we have to now teach kids how to mitigate the eventuality of a shooting, mass or multiple that it might be, it's really troublesome and it's very concerning. Stop all violence, stop gun violence. This is really more an imperative now than it has ever been. We're living into we're living an epidemic, and we are, as physicians, finding in many ways that there is low-hanging fruit. There is opportunities to teach as simple as a correct storage of a gun, sometimes to avoid a tragic event. This is not about the Second Amendment. It's not a political statement. This is an important and very valid statement that is common sense first and foremost. Educating to correct ownership might be one of those achievable goals that should be stressed. 1.2 million deaths from guns in the United States in the last 40 years. That should make you think. Chicago, I think, is one of the leading cities, and it's in the news a lot for their tragic events. We're seeing similar patterns, but they're more diluted to the attention of the communities, and certainly the pandemic took a lot of the spotlight. But we cannot and we should not forget how important these initiatives need to be. I will add that we can do better, we should do better, and really should focus on the things that make common sense first and foremost. We find many times in our daily clinical life the duress and stress that it puts on the teams, that it puts on the families. It's very hard to walk away after a family has been devastated by injuries such as this. There is a life-changing moment for the people and the victims that come to us from the many walks of life. I think for prevention we can use the significant amount of research that has been done. We are fortunate to have a great medical school in our community. I think Michigan is a very fortunate state. There is many communities that can engage and should engage and continue to follow this at a higher level. We can do better. There is a sense of duty as a physician to stand here. I stand for 8 colleagues in my group. I stand for all the nurses and all the colleagues in the emergency department, my colleagues on the units of the hospital, and all those that strive to give the community the best possible care. I think this is the best possible care. Start to prevent, start ahead and upstream, and make a difference for what it seems we're now finding to be inevitable and almost becoming accepting. The one request that I have is never become accepting of this as as another patient coming through the door. Just find ways that you can impact the community and certainly in a grassroots momentum. This initiative should really be for the people, for the better and the betterment of communities where we can feel the safety that we need to feel across. So I thank very much everybody for giving me an opportunity to speak on behalf of my group. As I guess as a closing statement, mass casualties take the spotlight. Multiple casualties are forgotten. We see them, and we see them every other month, every month. Summers are not going by without having seen multiple events that will lead to the second and maybe even the third surgeon coming through the door, which has more and more led us to ask ourselves what it is that we can do upstream. This is a great initiative, and I'm thrilled that this actually is going on in Michigan. I really think it will be a very important moment in the history of the state. Thank you very much.
My youngest daughter graduated from Portage Northern in 2019, and I remember a day when she came to me and she asked if she would get in trouble if she walked out with other students who cared very deeply about this issue. And I said, you won't get in trouble with me for walking out and standing for an issue that you care about. 2019, she graduated. Nothing has been done since. End Gun Violence Michigan has been active on this issue and advocating for legislative change for the past year. We thought that it was going to get a hearing and a chance, and it hasn't. Governor Whitmer, you campaigned on this issue. Many of your newly elected legislature campaigned on this issue, and there is no more clear message that it is our generation's responsibility, not my daughter's, and the time for change is now. Yeah. With that, what are we asking today might be your question. End Gun Violence Michigan, as sitting on the steering committee, is calling for the legislature in their first 100 days to adopt 4 key changes. First is to close a loophole by changing wording in the current legislation on universal background checks from handgun to firearm, and pass legislation that requires true universal background checks for those purchasing a firearm. When we polled this, it received 90% support. Polling this, that is almost unheard of in any kind of legislation. Second, introduce and pass legislation requiring homes with minor children, and for that matter, all homes, to safely store all their firearms. This comes with the realization that we now have more firearms in this country than we have people in population. That should disturb us. Additionally, the state must provide education, training, and funding to help gun owners store their guns safely. Third, introduce and pass legislation allowing family members, an intimate partner, and/or law enforcement to file extreme risk protection orders. These are also known as red flag laws against individuals at risk for harming themselves or others. This legislation would allow for the temporary removal of firearms for those at high risk of suicide or violence against others. Extreme risk protection orders must be approved by a court with a timely hearing, ensuring the protection of the rights of those served. Create education and awareness to help people have access to filing extreme risk protection orders. We know that when there is sexual assault and/or domestic violence in a home, Combined with the presence of guns, lethality increases. In fact, a domestic violence perpetrator with a gun, their partner has 5 times more likely to be killed. While an extreme risk protection order should help protect domestic and sexual assault violence survivors, we're also calling for legislation that prohibits those convicted of sexual assault or domestic violence from owning firearms. I can't say this more clearly enough. All of these are practical and logical policy strategies as legislative goals aiming to honor the desire of rights of Michigan residents to own firearms while also working to make our homes, our communities, schools, places of worship, and public gathering places safer. We have gathered here today and are calling the legislature to take action now. And on that note, Rabbi Schricker is going to close our call to action with prayer.
The prophet Jeremiah wrote, "Seek the peace of the city whither I have caused you to be carried, and pray for it, for in her peace shall you have peace." We gather today to bring awareness to gun violence in our state and to call upon the new Michigan legislature to make gun violence prevention a top priority in the new legislative session. We call on our elected officials today and every day at every level of government to act for the safety of our children and all of our residents, to act for peace. As the prophet Isaiah wrote, "They shall beat their swords into plowshares and their spears into pruning hooks. Nation shall not take up sword against nation. They shall never again know war." Just as our ancestors were told to change their tools of war into tools of peace, so too must we move from tools of war to tools of peace. Our community needs our leadership to place the sanctity of life as our joint priority. Gun violence is a public health crisis. It is a leading cause of death in children, as the doctors have explained today, and as our city and our country have declared in county. May we work as one community here in Kalamazoo and across our state to end gun violence today, tomorrow, and every day to come. Oseh shalom bimromav, huya aseh shalom aleinu, ve'al kol yoshvei tevel, v'imru amen. May the one who makes peace in the heavens make peace for us and all the world, and let us say, amen. Amen.
Do you have questions?
You mentioned that gun violence has increased against children nationwide. Do you know how much it's increased in Kalamazoo County overall, with children especially?
I'm not sure exactly. I use usually Trace. Trace has a lot of statistics, the trace.org. But I can't pull that figure off the top of my head, but it is the leading cause of death nationwide.
Dr. Romeo?
Yep.
You said, you talked about 200 patients suffered, I guess, from gun violence, but I wondered if that was Kalamazoo.